Thank you, Mr. Speaker, and thank you to the members of the legislature. This is a debate that's long overdue here and recognizes the deep sadness, grief, and anger developing at the inadequate and fragmented response to 5 years of increasing deaths due to addictions and mental illness, especially our young adults and First Nations. Most members and professionals have been surprised, I included, at the devastation this has taken, how quickly and quietly it has overtaken our health care, our justice system, our social services system. Surely there's enough statistical evidence and anecdotal stories to suggest this is indeed a public health and safety emergency in this province. Our two major municipalities are having their own discussions on how to tackle better this issue. Edmonton's Mayor Don Iveson is quoted as saying, quote, "There's no doubt this is a serious escalating crisis, so the time may well come for that declaration to be issued," end quote. Calgary's Mayor Naheed Nenshi reported saying, quote, "We lost more people to opioid overdose last year than the combined deaths from homicide and car collisions." We're not talking about this enough. We've got to do something, end quote. The Calgary Police Service is holding a public discussion on opioids March the 7th this week, expressing frustration at the lack of coordinated social and health services. Health stakeholders are holding this week, March the 9th, a public panel discussion at the University of Alberta Edmonton Clinical Health Academy on opiates. As an MLA, I'm hearing these concerns raised almost on a daily basis from constituents, advocacy groups, and professionals in the medical, policing, and social services systems. And as a physician, I can confidently say that the current levels of opioid addiction and overdose are beyond anything I've ever experienced in a lifetime of medical practice and constitute indeed a threat to public health and safety. Assuming that these last quarter reportings that showed 343 deaths, which was a 33% increase over the previous year, related to fentanyl, assuming that those similarly constituted only 57% of all opiate-related deaths, as was reported in previous quarterly reports, then another 43% of deaths has actually occurred this year that has been reported and are still awaiting final medical examiner confirmation. That would mean roughly 500 deaths last year, Mr. Speaker. We're approaching 2 deaths per day in this province. I happen to believe that the provincial health officer cannot be expected, with the resources she has, to manage this extraordinary, multidisciplinary, multi-departmental crisis. And consideration should be given to reinstate the provincial mental health and addictions officer that was let go last year. Critical to have someone in place with a mental health and addictions leadership background. I'd also like to see a clear, comprehensive plan for mental health and addictions, specifically on the opiate crisis, that is related to a collaborative stakeholder consultation, adequate shared resources, more open communications between these organizations, and a close monitoring to see what is working and what is not working in our systems of care. I hear too many reports that people are not getting help, are pushed from place to place, do not have a clear plan, and do not have the emotional or mental support to go through the very difficult, painful family challenge of getting off opiates. I also believe that resources beyond those currently being used are needed, and that the federal government has recognized this. It means we have to recognize other resources outside of Alberta, which is the definition of an emergency, when current resources fail to meet the needs of the emergency. While we don't necessarily understand all the dimensions of this epidemic, we must address the urgency. We must acknowledge we do not have the resources or expertise currently, or the coordination of resources needed to bring this under control. 5 years surely has shown us that. And with the recognition that we need resources, consideration should be given, as we have in other natural disasters, to call an emergency under the Emergency Management Act, if not the Public Health Act. This would demonstrate, A, that we now appreciate the unpredictable devastation of this evolving and increasing crisis. It would demonstrate, B, that we will develop a comprehensive plan and more effectively manage and mobilize the resources we have within this province, as well as seek other resources from outside the province. Why? Because we recognize this is a national crisis needing federal, provincial, and municipal collaboration. Why? Because unprecedented numbers of people have died, and the rate has increased progressively over the last 5 years, despite the welcome distribution of free naloxone that saves lives every day. It's not enough to save lives. We have to get ahead of this and get people off the drugs. Harm reduction elements are important. The tremendous and growing cost and the failure of our current approach, with tremendous loss of money and morale in our police service, in our social service, in our frontline health workers, who see the same people coming in again and again without getting the appropriate supports they need. And finally, why includes the need for strong and expert leadership focused on developing the plan that includes policing and justice system, human services, our education, including post-education system, and of course health, which should be leading the charge and coordinating this effort, as well as non-government agencies, some of whom are represented in the gallery today, and the professionals outside the health system that are dealing with this: social workers, psychologists, counselors. What is needed? The Government of Canada signed in November 19th, 2016, a joint statement of action to address the opioid crisis with 8 provinces and the Northwest Territories, but not Alberta. Why is that? Why was Alberta not at the table? More money needs to be directed at various sites and harm reduction approaches, especially supervised substitute therapy, and approaches to more focused leadership and a plan that includes all stakeholders. And I believe, Mr. Speaker, that new and expert leadership focused on coordination and integrating the partnering of these various organizations and stakeholders with experts in mental illness, addiction, as well as the police, social services, and schools is essential. Clearly enhanced funding for supervised injection sites and opiate replacement therapy are needed. Other harm reduction programs are needed beyond the big cities, where we know that we have much stronger resources available to deal with poverty, homelessness, including their families, in a comprehensive approach to their care. Doctors, too, are fundamentally involved in this crisis. They have been involved in prescribing too many opiates, failing to monitor the opiates and other psychoactive drugs, and according to the college's triplicate prescription program requiring all doctors prescribing opiates to register these, there's been a failure of doctors to check on individual patients on whether they're taking more drugs than they should be and continuing to take opiates from more than one physician. That is the responsibility of the medical profession and the college. To its credit, the college has finally brought in, this week, standards for opiate prescribing. Now they must monitor and enforce more stringently, confronting the painful truth that most addicts were begun on prescription opiates. My final comments, Mr. Speaker, are have been said.
Thank you, honourable member.
Well said, David.